Psychodynamic psychotherapy is not just about discussing and investigating repressed memories. Nor is it about just lying on a couch and staring at the wall while a therapist sits behind you and you talking for hours on end. If you do want to know what it's about, then you've come to the right place. Hello and a warm welcome. I'm Dr. Sil. I'm a junior doctor from Australia training to become a psychiatrist, and I work on mental health wards treating conditions like schizophrenia, depression, anxiety disorders, personality disorders, as well as people who are just in situational crises. And a big part of my training program for me to become a psychiatrist is performing psychotherapy. So yes, psychiatrists can perform psychotherapy, so do psychologists, and in all of my roles in mental health, I have worked in a multidisciplinary team with psychologists. I've helped to run group psychotherapy, and I've done one-on-one psychotherapy with patients. This video is specifically about one type of psychotherapy called psychodynamic psychotherapy. If that sounds like your cup of tea, then let's get into it. Now, although I was saying that psychodynamic psychotherapy is not just lying on your back staring at a wall while you're just free associating and talking about whatever comes to your mind, that is where it started. That is called free association. And that involved, it's essentially psychoanalysis, and it's what Freud did. You might have heard of Sigmund Freud, one of the, kind of the grandfather of psychiatry, definitely considered a very significant figure for multiple kind of insights that he wrote about, but particularly the discussion and investigation and characterization of our unconscious. Yes, we all have a conscious and we all have an unconscious, and it is a strange beast what goes on underneath, but it is something that you can kind of investigate and understand through different psychoanalytic and psychodynamic techniques. And what Freud used to do is to lie people down and have them kind of just talk about whatever comes to their mind, no matter what it was, no matter how ridiculous, how disgusting, how sexual, how horrible, how boring, how whatever. He just free associate, talk for 50 minutes, and then a psychiatrist or a psychoanalyst would interpret it. Now, psychotherapy has come a long way since conceptualizing everything in terms of someone's libido and the Oedipus complex and all that. It's much more refined than that. But what came out of that was an appreciation that we do have an unconscious, and that unconscious processes do influence decisions and the ways we act and our mood states. And eventually, psychodynamic psychotherapy evolved, and it is essentially a discussion between a therapist and a patient that has different principles. So let's discuss the core principles of psychodynamic psychotherapy. The first we've already touched on, and that's the appreciation that there are unconscious processes that are happening. Now, the goal is to make the unconscious conscious. We all have parts of our unconscious that we don't know about that influence how we behave, but bringing those unconscious processes into our conscious awareness helps us process them and helps us behave in a way that is not destructive to our goals. So for example, if someone was very attracted to their boss, but they were ashamed of that, maybe that shame was unconscious, maybe the attraction was even unconscious, and it would lead to them hating their boss and maybe making nasty comments. When you bring all that up to the conscious arena, you can then understand it, form a narrative around it, and behave accordingly. The next principle is about transference and countertransference. And so an example of transference is that maybe the therapist reminds the patient of someone who they've known before. Maybe the therapist reminds them of a parent, and maybe that makes the patient act in a certain way. Maybe it makes that they're irritated with an authority figure because they were angry at their parents for being too controlling. You can explore that transference. The other thing to explore is the countertransference. How does the therapist feel towards the patient based on the therapist's previous relationships? Maybe the patient reminds them of their daughter who was naughty and didn't follow rules, and then the therapist wants to be punitive and punish them. These unconscious processes need to be explored on both ends, both the patient and the therapist. And ideally, they can talk about it together. Transference and countertransference is so important because what is happening with the therapist. So if what's happening in between a patient and their therapist is likely to mimic or model what is happening between that patient and other people in their lives. The next principle to discuss is that about defense mechanisms. Yes, so we talked about the unconscious, and there's a lot of conflicts in the unconscious. You might have heard of the id and the superego. The id is that childlike, primitive drive, the primal urge to grab, to eat, to have sex, to break things, to get angry, to steal. That's the id. That's the inner child, the demon on the shoulder. And then there's the superego. You know, the authority figure, the paternal, well, the parental figure, I should say, and they should and it should tell you what's the right thing to do. No, you shouldn't go and steal that. No, you can't do anything immoral. This is who you wish. These are the rules you impose on yourself, and that causes a lot of unconscious conflict, which can generate anxiety. Understanding the conflict and the defense mechanisms that eventuate is very important. So some people have, we all have a range of defense mechanisms. Okay, some are helpful, some are unhelpful. They're categorized differently from a psychological point of view, but I like to just think of them as helpful and unhelpful. Helpful ones include things like humor. Sublimation. Sublimation is when you take the negative energy and anger from one thing and you put it into something helpful. So if I had a bad day at work and I wanted to, get angry at my boss, my id wanted to get angry at my boss, well, I sublimate it into something else more productive, like punching a boxing bag and getting healthier and fitter. That's a good example of sublimation. There's heaps of different defense mechanisms out there, and I've made videos about different ones. You can check them out. But understanding the defense mechanisms we use can help us shift the unhelpful ones to the helpful one. Often a big part of psychodynamic psychotherapy is talking about the next principle, which is past experiences and childhood. It just is the case that childhood and your experiences in childhood shape your later development and who you are today. And I guess an important thing to say is psychodynamic psychotherapy is not for everyone, and if you do not want to talk about anything, you never have to. Okay, it's a good clinician will support you and not push too hard on the things that you're not ready to talk about. Now, another thing about psychodynamic psychotherapy, the final principle I wanted to talk about is the relationship between the client and therapist, and this is a bit different to transference. Transference is about how the relationship is mapped off of previous relationships, but the helpful and beneficial thing of the actual relationship is essentially you're going to see someone who genuinely wants to listen, wants to understand, and wants to help. And that practice in and of itself, beyond all technique, just someone being human and connecting with you, is helpful in itself. And although you might have modeled previous relationships and maybe those relationships weren't great, so you have these unhealthy patterns of previous relationships, having someone just try to understand you, care, and help, that can help change your models. It can build new neural circuits that you can then have a new idea of what healthy relationships look like. And there's an interesting concept around people actually internalizing their therapists in a way. So they project out these different emotions, anger, hate, disgust from different things that might have happened. The therapist takes in those emotions, processes them with you, and puts them out into a narrative that you identify with, and then you change a little bit. Now, I know some of this can sound a bit abstract. Don't stress. You don't have to understand all the different defense mechanisms to do the therapy. That's more for the psychologists and the psychiatrists. Now, to talk a bit about the structure of how it goes. Well, it's usually it can be up to 3 or 4 times a week. It's more regular than something like CBT, cognitive behavioral therapy, or acceptance commitment therapies. And typically you will have an assessment phase of about 5 sessions or so. And then at the end of those sessions, at that assessment phase, the therapist should provide you with a bit of a treatment plan or an agreement to say, let's do 30 sessions, 40 sessions, and revisit. And you should have a piece of paper that you can kind of read out the expectations of the therapist. They might say that it starts at 5 past the hour and finishes at 5 to the hour, and that you meet at this time every week. It's important to try and keep it regular to maintain that kind of containment and regularity. The other thing to appreciate is that these sessions are a little bit different to other therapies in that they're not that structured. It's not really about identify the feeling, then identify the preceding thought, then discuss the pros and cons of that thought, then describe the behavior that eventuated, then see how we can do a chain analysis to, it's not that structured. It's much more free association. So I often get told that I do very little guiding and that people want a bit more guiding. But it's about letting someone's unconscious come up and reducing the barriers and the resistance to that unconscious coming up. Now, after the assessment phase, there is the bulk of the therapy, which is the exploration and working through phase. Now, some patients might have goals and particular conflicts that they want to work through. Some people don't really, they know something's wrong, but they don't know quite what it is, and they want to just kind of explore, and that's fine. And then that's what the bulk of the therapy is, and that's usually about, it can range with different people. Some people it lasts years, some people it lasts 20 or 30 sessions, but eventually that does end, and you go to the termination phase, which is really about consolidating the gains of the therapy and preparing for the future. Now we've talked about the principles of the psychotherapy, the psychodynamic psychotherapy. We can talk about the techniques that are used by the therapist. Now we've spoken about free association, which is just letting someone freely speak, uninterrupted, with minimal guidance about whatever's coming to their mind. And sometimes it's related to a theme. So I might ask someone, what's your relationship with aggression and anger? And see what comes to mind and explore that. That's probably the bulk of psychodynamic psychotherapy. But then there are other things that happen too. So interpretation, which is when the therapist provides an interpretation of what's happening and discusses that with the client. So for example, a client might be describing that they're having many relationships that start off with pure bliss and love, and that people are, the definition of perfection, and then very quickly relationships are falling apart in chaos and drama. And an interpretation of that might be that the person uses splitting as a defense mechanism, which is something where essentially people see others as all good or all bad, and kind of has a black and white thinking element of it. And you can explore why someone might have that, especially it might relate to how their caregivers were attuned to them as children. So that's an example of interpretation. Another technique uses dream analysis. So someone might describe a dream and exploring with them what does what happens in the dream mean? Like what could be the unconscious process and the symbolism in the dream. I have found that dreams do provide a kind of window into the unconscious. Of course, when we do these dream analysis or these interpretations, we will frequently come, we'll come to resistances. And this is another technique, exploring resistance. So if someone is disclosing something quite emotional and then they quickly start talking about something quite academic or cold or factual or intellectual, well, why did that happen? Why couldn't we sit with that uncomfortable emotion? Why wasn't it safe? Were there things in childhood that meant that it wasn't safe to feel emotions, and now we use these other defense mechanisms like intellectualizations, things like that. And then the final technique is related to transference. We talked about that earlier, and that's kind of exploring why is the patient feeling certain ways about the therapist? What previous relationships are coming back up and unconsciously affecting how they feel towards the therapist? So for example, if it's that client example of the person in the relationships where people are perfect and then terrible, is that coming up in the relationship with the therapist too? Are sometimes they the best therapist in the world, they understand everything, and then other times they're just useless, crappy therapists? Are they getting that black and white, good and evil thinking? That's all very good content. That's grist for the mill to explore in psychotherapy. So in terms of the indications for psychodynamic psychotherapy, there's a wide range of illnesses that benefit from it. So things like depression, anxiety disorders, OCD. Now, PTSD and CPTSD. So CPTSD is complex PTSD, so childhood trauma and things. These things can really be helped with psychodynamic psychotherapy, but not for everyone. So that is why there's an assessment phase. So not everyone is a good candidate for psychodynamic psychotherapy. It requires a lot of psychological mindedness, a willing to introspect, a willing to kind of be uncomfortable. It can be confrontational to hear a therapist's interpretations of your defense mechanisms. It can be anxiety provoking at times, and sometimes things get worse before they get better. So it's not for everyone. But it is of benefit for so many people, and the cool thing about psychodynamic psychotherapy is that it's skill building. So often people get benefits even after the therapy ends because they have gained insights into how they operate. Now, psychodynamic psychotherapists, their training is extensive. I am not a trained psychodynamic psychotherapist. I am training to become a psychiatrist. The therapists will either be psychiatrists or psychologists who have done some psychodynamic training. Now, in terms of the limitations of this kind of therapy, well, it takes a long time and it costs a lot of money. Now, some people benefit very quickly with psychodynamic psychotherapy, but some people, it can take a long time, years. So that means that it costs a lot of money and not everyone can afford that. It's also hard to study because it's hard to blind someone. So you can't do controlled trials of a placebo psychodynamic psychotherapy. It doesn't really work. You can't do a placebo psychodynamic psychotherapy really. So it's been harder to show the evidence base as opposed to other therapies like CBT who have huge evidence bases. But there are, ongoing research showing that it is beneficial for a whole host of diagnoses. So watch this space. So look, guys, to conclude, it's a very important therapy to consider. It's one of the big therapies. I find it really meaningful to do psychodynamic psychotherapy. I think even if I'm not a psychodynamic psychotherapist, it's important to be psychodynamically informed in all of my interactions with friends, with clients, with patients, and that just means acknowledging the role of the unconscious in people's decisions and behaviors, and creating a authentic, connected, safe space where we can safely explore these things, and hopefully just get a little bit better. If you want to learn more about psychodynamic psychotherapy, you can consider looking into the different theories, things like attachment theory, Kohut's self-psychology, the object relations theory, and ego psychology. But that's beyond the scope of this video. But that is it for this video. That's all I wanted to talk about. I wish you all a beautiful day. If you enjoyed it or found this helpful, please consider subscribing to the channel. That really helps me out. And leaving this video a like will help it be recommended by the YouTube algorithm. But other than that, I'll see you all in the next video. And that is it. Bye for now.